Many patients with arthritis of the hip and knee avoid using their painful leg. Muscles can become weaker, and it's really important to start an exercise program before surgery and also continue one after surgery. Over the next few minutes, we will discuss how to begin an exercise program to aid in your recovery. Consult your doctor before starting preoperative exercises. Multiple exercises are listed in the pre-op section of your guidebook or in the Center for Joint Health pre-op exercise video. Your doctor may instruct you to start these exercises and to continue until your surgery. Take 15 to 20 minutes twice a day to do your exercises and perform exercises on both legs. After your surgery, you will continue to do these exercises 2 to 3 times a day as instructed by your physical therapist. It is also important to strengthen your entire body, not just your legs, before surgery. Strengthen your arms by doing chair push-ups because you will be relying on your arms when walking with a walker, getting in and out of bed and chairs, and on and off the toilet. Perform light endurance activities for your heart and lungs, walking for 10 to 15 minutes each day. Whether you are having a hip or knee surgery, these 7 exercises are recommended for your pre- and post-surgery exercise routine. Number 1, ankle pumps. Number 2, quad sets or knee pushdowns. Number 3, gluteal sets. Number 4, abduction and adduction. Number 5, heel slides. Number 6, short arc quads. And number 7, armchair push-ups. Ankle pumps. Flex and point your foot. Perform 20 times. Quad sets, also called knee pushdowns. Lie on your back. Press knees into mat by tightening muscles on the front of your thigh, your quadriceps, and hold for a 5 count. Do not hold your breath. Perform 20 times. Gluteal sets, also called bottom squeezes. Squeeze bottom together, hold for a 5 count. Do not hold your breath, and perform 20 times. Hip abduction and adduction, also called slide heels out and in. Lie on your back with toes pointed to the ceiling and knees straight. Tighten quad muscles and slide leg out to side and back to starting position. Perform 20 times. Heel slides. Slide heels up and down. Lie on your back and slide heel up a flat surface, bending the knee. After surgery, your therapist may use a strap around your foot to assist gaining knee bend. Perform 20 times. Short arc quads. Lie on your back and place a 6 to 8 inch rolled towel under your knee. Lift your foot from the surface, straightening your knee as far as possible. Do not raise your thigh off the rolled towel. Perform 20 times. Armchair push-ups. Sitting in a sturdy armchair with your feet flat on the floor, scoot to the front of the seat and place your hands on the armrest. Straighten your arms, raising your bottom up from the seat as far as possible. Use legs as needed to lift. Progress to only using your arms and your non-surgical leg to perform the push-up. Do not hold your breath or strain too hard. Perform 20 times. The next 5 exercises are for persons having hip surgery. Knee extension or long arc. Sit with your back against the chair and thighs fully supported. Lift foot up, straightening your knee. Do not raise your thigh off of the chair. Hold for a 5 count and perform 20 times. Standing heel or toe raises. Stand with a firm hold on a stationary object. Rise up on toes, then back on heels. Stand as straight as possible. Perform 20 times. Standing rock over affected leg. Stand sideways to countertop and hold on. Keep the affected leg and heel firmly planted on the floor. Step forward with the other leg to feel a slight stretch in the calf and thigh. Make sure your knee does not go past your toes. Step back. Concentrate on shifting weight to the affected side and on equal step distance. Perform 10 times forward and 10 times back. Standing mini squat. Stand with feet shoulder width apart and holding on to a stationary object. Keep your heels on the floor as you bend knees to a slight squat. Make sure your knees do not go past your toes. Return to an upright position, tightening your buttocks and quads. Keep your body upright, heels on the floor, and do not squat past 90 degrees hip flexion. Perform 20 times. Standing knee flexion, also called hamstring curls. Stand with your feet shoulder width apart, toes pointing forward and holding on to a stationary object. Tighten your gluteal muscles and bend your knee, lifting your foot off of the floor. Do not bend forward or let your hips bend. Try to keep a straight line from your ear through your shoulder to your hip and knee. Perform 20 times. The final 4 exercises are for persons having knee surgery. Seated hamstring and gastroc stretch with or without a strap. Sit on the couch or bed with the exercise leg extended and the other leg dangling off of the side. Keeping exercise knee straight, gently lean forward until a slight stretch is felt in the back of the thigh. As you become more flexible, use a strap to pull up on foot. Hold for 20 to 30 seconds and perform 20 times. Straight leg raises. Lie on your back with the unaffected knee bent and foot flat. Tighten the quad muscle on the affected leg and lift the leg 12 inches from the surface. Keep your knees straight and toes pointed toward your head. Perform 20 times. Seated knee flexion. Sitting in a straight back chair, bend the affected leg as far as possible under the chair. You can use your opposite foot to help. When a maximum bend is reached, plant your foot and slide hips forward, further bending the knee. Hold for 20 to 30 seconds and perform 20 times. Knee extension stretch. Sitting in a comfortable chair, prop the foot on the affected leg on a chair or stool. Place a towel roll under your ankle so your calf is unsupported and apply an ice pack and a 5-pound weight or a bag of rice on top of your knee. Hold position for 15 minutes. If you have any other questions or concerns about daily activities as you heal from your surgery, feel free to contact your physical therapy team or your surgeon if you have any questions.